Welcome to another edition of the Daily Vlog. My name is Dr. David Duizer. Thank you so much for tuning in. I'm a naturopathic doctor in Vancouver, British Columbia, and the medical director at DailyHealth.com. On this show, we talk about all things holistic health and wellness related. If you're interested in more, please subscribe. Today on the show, we're talking about naturopathic medicine in general and what my clinical practice is like. I'll start by saying I'm practicing in British Columbia, Canada, where we have a broad scope of practice and we're able to practice primary care naturopathic medicine, which means we're able to run labs, we're able to treat disease, we're able to use pharmaceuticals, we have prescription rights, we have a broad scope of prescribing capabilities in this province. So I'll start by saying that. Naturopathic practice in general is focused on our 6 principles. That's what guides our therapy. Our 6 principles of naturopathic medicine are: first, do no harm; then treat the cause, treat the person as a whole, use the healing power of nature, practice prevention, and doctor as teacher. So those principles really shape the way we practice on a day-to-day. We practice, of course, person to person, using evidence-based medicine as much as possible for the therapies that we use, but at least evidence-informed medicine at a minimum. So our practice and our principles of medicine then direct us to the therapeutic order that we have. The therapeutic order really is a way of practicing that goes from least invasive to most invasive. We use our principles to try to develop a therapy for a person that is non-invasive. And then if more invasive therapies are required, we will go there. In this province, we have minor surgical rights and we have injection therapy rights. So we're able to do things like IV therapy and B12 injections. And in my clinic, we do liquid nitrogen for removal of skin tags and moles and other lesions. And many clinics will use their minor surgical abilities. But we try not to do those therapies when we don't have to. We try to use the non-invasive therapies as much as possible. Those therapies include things like nutrition therapy, physical medicine, like cold laser and therapies like that. That could include acupuncture and cupping and other types of therapies. We do herbal medicine. We do, of course, in this province, pharmaceutical prescribing. We have a broad range of therapies that we're able to use, and we have a broad array of research now that we're able to that allow us to implement these therapies in a research-based setting, using protocols that have been proven to be effective. So we're very fortunate now to have at least evidence come up for most of the therapies that we provide, and it has allowed many of our protocols to actually be evidence-based, so we're very thrilled about that. At a minimum, we practice on a physiological basis using nutrient depletion studies to inform our nutrient prescribing, and we see great success with prescribing like that. This allows us to be completely non-invasive and very gentle in our therapeutic modalities. With nutritional therapy, supplemental therapy, herbal medicine, we always bring our protocols back to the principles. The main principles that shape our protocols would be things like treat the cause, try to use conventional testing and functional medicine testing or advanced medical integrative testing to find out the cause of disease and to then practice holistically. So treat the cause and then support all of the systems of the body to manage the disease and promote healing. So what does all of this look like? All of this looks like a primary care setting that is heavily focused on a holistic approach to chronic disease management. And I say a holistic approach because it really is all-encompassing. When we have someone coming in, for example, with high cholesterol, we're able to do nutrient therapies, but we're also able to prevent disease by managing stress. We're also able to prevent disease by reducing weight, by improving sleep. So we're practicing a holistic approach, but also using either a natural form of a cholesterol-lowering agent, like, for example, what statins were originally developed from, or we're able to prescribe a statin if we absolutely need to and if it's indicated. If someone comes in with, say, generalized anxiety disorder, we're able to use medications that could be prescribed in that case, but we're also able to get started on replacement therapy and to get started on cognitive behavioral therapy. We're able to get started on improving exercise tolerance, and we're able to get started on all of these different therapies. We're able to acknowledge the gut-brain connection and treat the digestive tract to help calm anxiety. We're able to do all of these things because our scope is so broad. Now, with a broad scope, we're very fortunate, of course, but like any profession, there are a range of practitioners. There are a range of naturopathic doctors and modalities used and tests used. In some clinics, after the standard of care is met, after diagnostic techniques are exhausted, energetic techniques can come into play, and energetic therapies can be used. We're able to do that because in our practice we're able to first cover the basis and keep people safe, and of course then we're able to go beyond and look at the mind-body connection and the mind-body-spirit medicine in general. So we're very fortunate to be able to do this. And of course, in my practice, I don't do a ton of energetic assessments, and I don't do many energetic therapies, but some naturopaths do, and who are trained and do a great job in those types of practices. So we're very fortunate, of course, to have this broad scope of therapies. But in this province, and in many provinces across Canada and states across the U.S., fortunate to also practice primary care and use pharmaceutical therapies only when needed, and after more non-invasive gentle therapies have been utilized. So always going back from the principles to the therapeutic order, starting with non-invasive, trying to treat the cause while suppressing symptoms, and only if needed going to pharmaceuticals, but having those in our toolkit has of course been essential for us. That's naturopathic medicine in a nutshell, the principles, the therapeutic order, how I like to practice in my one small clinical practice here in Vancouver, British Columbia. I love it so much. I hope that this video has been helpful to guide your decision making when you're choosing a medical practitioner, a doctor in general, and I'm grateful to have this platform to speak about our medicine. So thanks so much for tuning in. I want it to be known that I love all aspects of naturopathic medicine, and so grateful to be a part of this community. This community is very, very supportive of each other, and I love holistic practice in general. And I think that where naturopathic medicine thrives is bringing integrative and functional medicine to the forefront and working in chronic disease management at a level where many other professions haven't been able to, because either they don't have the time or they don't have the training in all of these different facets to actually implement them on a case-by-case basis. So grateful to be able to do that. Thank you so much for tuning in. If you love holistic health and wellness videos, please subscribe to our channel. I'll be speaking about my journey a little more in the future, mixing it in with the holistic health videos. If you like this kind of content, please subscribe, and we'll see you next time.